Hello everyone. Today's video is about a really tough case of sinus mold slash sinus infection slash something going on in the sinuses that patients having a really hard time getting a handle on. Just before jumping into the video, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. This individual messaged me on Instagram and gave me a lot of information about her background, and unfortunately I somehow missed a message, and as I'd asked for more clarification and missed the message, and so anyway she messaged me back in July, and so I finally got back to her just a couple days ago saying like, oh my gosh, I'm sorry that I missed this. And anyway, she gave me an update though, saying, oh, how are you doing now? So it's kind of a anyways, I guess the silver lining to me forgetting is that now we have more of an update in terms of what's going on. So I'm just cross-referencing here on my laptop the information she sent me. It was quite a bit of information, so I'm going to sort of paraphrase it down here a little bit for the purposes of brevity. So it looks like she had been living in a home that, found out, she was living in it for about 5 years, found out that it had tons of mold in it, stalactites of mold, she says, which is just, I just don't even want to know what that looked like. It sounds pretty awful, so I'm sorry to hear about that. And looks like there was, she was developing a lot of worsening symptoms for the 5 years that she was living there. So she got quite sick, and then let's see here. And so she's doing quite a lot better, and quite a lot's come along. She says she still has at least another 30% of the way to go to getting better. Let's see here. Okay, and there's some hormonal factors going on, and right, and so she's saying here, so I'm trying to treat mold in my sinuses. One of my worst symptoms has been weakness down the right side of my body. The left side of my body feels perfect. I have dizziness on that side, this strange sensation when I blink behind my right eye and feel like my mouth/face was sloping downwards on that side, like I was having a stroke of some sort. That's very stressful, but that is something that I've seen in some of my patients where they're having these very profound, scary symptoms, and it is stemming from their sinuses, just as a point of interest. Not saying that's definitely what's happening in this case, but so I'm not giving any medical advice, but that is something I have seen in some of my patients. Let's see here, and let's see, now I'm getting better. I can hone in on the symptoms more and feel like a lot of it is in my right ear. I have this strange tickly/pain sensation in it, and feel a constant thick mucus down the back of my throat. This would make sense why I get the dizziness. I've been doing X-Clear, which is a xylitol-based nasal spray, and Argentyn Silver. Argentyn is a silver product, as the name suggests, because Argentyn Silver, also known as Argentyn 23, because it's 23 parts per million silver, which in my humble opinion is a very mild silver. The one I typically recommend, as I mentioned in some other videos, is called ACS 200. It's 200 parts per million, so it's about 9 times stronger, give or take. So saying that those things are helping, but I'm desperate to get better as soon as possible. So let's see, so she's saying she was interested in a video that I posted about Marcons and ozone treatment, and so she booked into a clinic where she lives in Dublin, and basically the doctor there said that he recommended that she get sinus ozone injections, so like right into the sinuses, which goes in just above the canine teeth, so through the upper gum line, so to speak. So injecting ozone right into the sinuses. Also recommended a sphenopalatine ganglion block, which she said she wasn't sure why that was recommended, because she wasn't getting headaches and things like that, but she was kind of taking their advice. And so let's see here. Yeah, so that was kind of the update, and so as of July, and so then here we are a couple of months later, and I asked, how she was doing now, and so let's see, so she said she still has a ways to go. Okay. Oh, right. And so she said that she, okay, sorry folks, there's just a lot of text here, so trying to summarize on the spot here. So just reiterating that the X-Clear was helping a lot, and that she'd added oregano and some other antifungals, and I think just the combination, she says, has been a complete game changer. And then she's done some of the ozone treatments, like the ozone injections into the sinuses, and then she's also done 10 intravenous phosphatidylcholine IVs. And so if I'm understanding correctly here, I think that ultimately the question is just around, like, what are the is it absolutely, do I have any experience with ozone injections into the sinuses? Is that kind of the only way to go? Are there other options that are available? And I think that's kind of the gist of it. So for the person asking the question, I hope I encapsulated that pretty well. Sorry for all the pauses there, folks. Just trying to summarize it. And I probably should have just read it verbatim. Probably would have been faster. But anyways, here we are. So again, obviously not giving any direct advice for this case. In my experience, when there are really persisting sinus issues after mold exposure, the tools that I tend to employ the most in practice are definitely strong silver nasal sprays. So, like, something in the 200 parts per million realm is typically what I recommend for my patients. I also oftentimes will recommend diluted essential oil sprays. I always like to emphasize diluted, because if one was to spray straight essential oils up their nose, it's going to hurt a lot and probably cause a lot of mucosal damage. So it has to be diluted in saline. Unfortunately, I can't give any prescriptions over social media, so I can't talk about like exactly what concentration and this and that. Dr. Jill Krista, amazing naturopathic doctor, she has some YouTube videos. She has a wonderful book called Breaking the Mold. It's a pun on treating mold, and she has protocols in those books. So U.S. doctors have different parameters that are put on them, and then us poor beleaguered Canadian naturopathic doctors, so we can't say much on social media, but those are some really good resources to potentially check out to learn more. Anyway, so essential oil nasal sprays, which I had been using prior to learning from Dr. Krista, but she inspired me to modify my protocols. So I very much follow the Dr. Krista inspired nasal spray protocols for my essential oil nasal sprays. If that's not strong enough, so like when patients come in to see me and they're, say, using X-Clear, it's a pretty common, easy to access nasal spray. I look at X-Clear as being like, not to throw it under the bus or anything, I think it's a fine product to use for different conditions, but it's quite mild. Xylitol, in my opinion, is not a strong thing to spray up the nose. Argentyn 23, not a strong thing to spray up the nose. That's kind of like maybe entry level. Again, not saying it in a disparaging way. It's great for more mild conditions, but it is not a strong treatment at all, in my humble opinion. If folks get amazing results with it, wonderful. They didn't need something stronger, but it's quite a bit weaker than ACS 200. Those treatments are quite a bit weaker, in my opinion, in my experience, than essential oil nasal sprays. Sometimes that's not even enough, and we have to upgrade it to using a nebulizer. Nebulizers are able to better penetrate all of the nooks and crannies of the sinuses, so oftentimes we'll use nebulized thyme essential oil. Sometimes a couple of times a day even. Sometimes nebulized silver, just kind of depends on the case, but oftentimes we'll get the job done with the nasal sprays, but sometimes we have to upgrade it to a nebulizer. Sometimes when we upgrade it to those stronger treatments, we have to get more detox support on board, like higher doses of, say, activated charcoal or other binders. Sometimes we need more glutathione because it can really shake the bushes or rustle the bushes a lot to let more mycotoxins out into the open when we start killing off mold more aggressively. So that's something that I always keep an eye out for. As far as ozone goes, in my opinion, ozone injections into the sinuses, which I have done many of them in my day, they are a really, really strong treatment. I do not dispute that in any way, shape, or form, but they are invasive and they are expensive because you need to pay someone to do them for you. And I'm at a point in my practice where I very, 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 very rarely do them now, because I have found that these sprays and nebulizing treatments work better. So as much as I miss the old days where I used to inject sinuses all the time because I didn't know about all this other stuff, I'd say that kind of sarcastically. I don't like inflicting pain on patients, but I rarely ever inject sinuses now because these other treatments, they pack a really good punch. I think IV phospholipids, I've heard some good things about them. I actually just did I'm doing this continuing education, listened to this webinar from this other doctor, and he was saying like they're great, but oftentimes you need like anywhere from like 30 to 60 treatments to see results. That's expensive, that's cumbersome, that's really tough, so we don't tend to do a lot of those either. I hope this was helpful. Any questions, just post in the comment section below.